Hi, my name is Derek Luke, and I work for the University of New Hampshire Center for Professional Excellence in Child Welfare, also known as UNHCPE. It's kind of a mouthful. We are a contracted service through the New Hampshire Division for Children, Youth, and Families, and we provide training for child welfare staff, child protection, and juvenile justice. And we also put on some pretty large events. The DCYF Teen Conference, DCYF Annual Conference, Court Improvement Project Summit, and hopefully some new ones soon. I thought I would give a quick introduction to our program and talk about our mission, vision, and the values in both the mission and vision that would help our social media marketing plan grow. The University of New Hampshire Center for Professional Excellence in Child Welfare draws on the extensive resources of UNH and its faculty research to provide training and professional development support to child protection and juvenile justice staff of DCYF. Our mission is to provide the most current and innovative training curriculum in order to facilitate the ongoing development of child welfare professionals. We support the mission of DCYF by providing educational opportunities that enhance the outcomes of safety, permanency, and well-being for New Hampshire's children and families. Our vision is to provide an innovative approach to professional growth through unique partnerships with state social service agencies, right now DCYF, and educational institutions, the University of New Hampshire and Granite State College. Granite State College currently holds the contract for foster and adoptive parent training, as well as residential providers, their staff. Residential providers are like Easter Seals or Spalding Youth Center. UNHCPE also envisions that child welfare workers will become proactive agents in their professional development through a technologically advanced network of multidisciplinary workshops designed to meet their specific needs. Right now, child protection staff have access to the University of New Hampshire's knowledge management system, their KMS. It's Blackboard. And on there, they have a series of online trainings that they can take. They're from the Children's Advocacy Center. Some of the content is generated through MSW students from the social work program at UNH, as well as conferences and seminars that we have access to their curriculum. UNH's purpose is to provide the most current and innovative training curriculum through their unique partnership with local and national resources. The local New Hampshire-specific examples include UNH's Institute on Disability, the UNH Department of Social Work, UNH Brown Center for Innovative Learning, UNH Center for Excellence in Teaching and Learning, UNH Justice Works, and the UNH Crimes Against Children Task Force. On the national level, UNHCPE partners with several child welfare programs, including the Tennessee Center for Child Welfare, Wisconsin Child Welfare Center, Kent School of Social Work at the University of Louisville, Connecticut Department of Children and Families, and the University of Vermont's Child Welfare Training Partnership. The values and goals of our program, highlighted in its mission statement, inspires the activity of creating a social media presence for its purpose of providing the most current and innovative training curriculum. Our vision statement also encourages the use of social media by creating a network of like professionals in training and education to ensure child welfare workers will become skilled at their jobs through a technologically advanced network. So here's our small team of 7 staff that are tasked with providing training, consultation, and technical assistance to DCYF. The recent addition, program assistant, who is a godsend, is not shown. This is taken from our DCYF conference, May of last year. I'm the guy in the middle next to our director, Christy Davis. Before I get into the actions and results of UNHCPE's social media marketing plan, I'd like to give a brief overview of social media and child welfare, with 2 main points: using social media for organizational transparency and using social media to raise awareness on the abuse and neglect of children. Before I get into the actions and results of UNHCPE's social media marketing plan, I'd like to talk a little bit about social media and child. Before I get into the results of our social media marketing plan, I'd like to give a brief overview of social media and child welfare, touching on 2 main points: using social media for organizational transparency, as well as using social media to raise awareness on the abuse and neglect of children. Right now, UNHCPE coordinates speaking engagements for different agencies, schools, hospitals, universities, where current social workers or DCYF administration talk about how to report abuse and neglect and current practices DCYF is doing. The use of social media could reach more people than an in-person training, just because of the reach of social media. An example could be the town hall Twitter meeting that Barack Obama did. Barack Obama has used social media to increase organizational transparency on the federal level through the White House Twitter handle, and he used his own Twitter handle for his campaign efforts and to introduce new policies through his tweets. What I thought was really interesting was the president answered a series of questions on jobs and the economy at the first ever Twitter town hall meeting at the White House on July 6, 2011. This was a historical event connecting technology and an in-person press conference. As of 1/29/2013, Barack Obama has 26,728,887 followers. He follows 666,354 other Twitter handles, and he has generated 8,410 tweets. His most recent tweets have been about immigration reform, gun violence, the Violence Against Women Act, and they include links to the White House fact sheets and his personal recommendations for revised policies. So that's on the federal level. On the local level, or statewide level, we can use social media to build relationships and to be proactive with messaging instead of responding to crisis situations, just like what Brian Gregg said in this slide. It's more of a proactive approach in engaging a community with education for their services, as well as creating a trusting relationship with the community. So we move on to using social media to raise awareness on abuse and neglect. Only a handful of child abuse and neglect stories receive media attention. The stories that appear in print and broadcast media often involve sensational cases that have tragic elements of disturbing injuries or even death. Most child abuse and neglect cases do not rise to the level of traditional media's representation. What we can do is take advice from social media marketers who utilize various platforms such as Facebook, Twitter, and YouTube to participate in an already occurring conversation about a product or service. Organizations whose goal is to prevent, assess, and treat child abuse and neglect should take part in a greater discussion or a conversation steered by print and broadcast media, calling attention to sensationalism and exploitation of the most tragic elements or the most horrific cases in child welfare. Public awareness should change. Along with programming, we must develop new child maltreatment prevention messaging that empower people to make changes in their own behavior, support changes in the community, messages about encouraging, supporting parents, protecting children, and building healthier communities. I'm going to do a SWOT analysis, starting with strengths. Our program has significant strengths as a training program for child welfare professionals. We have a large record of successful large events such as the DCYF Conference, DCYF Teen Conference, the Court Improvement Projects, Summits, CASA DCYF events. We provide a core training series to all new child welfare workers, and currently we're revamping the Juvenile Probation and Parole Officer Academy to have updated material and meet the new policy initiatives for DCYF. We also have provided technical assistance and consultation to local and national child welfare training agencies. Most of these agencies that we give technical assistance to and consultation, they already have an established social media presence, including individual and organizational Twitter accounts, LinkedIn profiles, Facebook pages, Pinterest boards, and YouTube channels. Along with providing technical assistance, we've received technical assistance and consultation from local and national child welfare training agencies. These agencies also have Facebook pages, Pinterest boards, YouTube channels, Twitter accounts, and LinkedIn profiles. Our primary audiences is a contractually assigned customer base of New Hampshire child protection social workers and juvenile justice probation and parole officers. We also do training, consultation, and technical assistance for DCYF administration. There are many people that benefit from our trainings that we don't normally target our trainings to. Those include court-appointed special advocates, Sununu Youth Services Center counselors, clinicians, teachers, GALs, anyone in the child welfare arena that's not a CPSW, JPPO, or DCYF administration. We're fully staffed, which is a big strength, which enables us to take the next step and implement the social media marketing plan and campaign, where most of us are very well versed in social media applications, and the purpose qualifying us to professionally and strategically use social media platforms and applications to engage current and potential partners in child welfare training, technical assistance, and consultation. So we're going to move on to weaknesses. This weakness we have no control over, but it is internal, and it's the technology and the various restrictions of state technology. It's the state of New Hampshire technology in general. They have a lot of web blocks that block social media sites, which would limit child protection workers and juvenile justice officers to access or have permission to view Facebook, Twitter, YouTube, and Pinterest. Moving on to opportunities. This social media marketing plan could add value to the training, consultation, and technical assistance we are contractually assigned to give to our child protection social workers and juvenile justice probation and parole officers by giving them the opportunity to continue their education and professional skill through the use of social media platforms and applications. We can teach them how to use it, but the content that we put on our Facebook, LinkedIn, Twitter, the social media applications that we're going to use could help continue their professional growth by connecting it to the training curriculum that we provide in an in-classroom training style. Also, select professionals have access to state-issued smartphones and laptops, and they can acquire wireless internet. These platforms can skirt around website blocking applications enforced by the state of New Hampshire and can start generating a momentum for our accessible social media presence. A lot of CPSWs and JPPOs also have personal smartphones, which they could gain access to any of the platforms that we decide to use. Moving on to threats, competitive vulnerability is constant with any state-issued contract. State-issued contracts are put up to competitive bid every 2 years, and it's our expectation to use a social media campaign along with our proven track record of successful professional services to local and national child welfare agencies to mitigate the risk and vulnerability of losing our contract to provide training, consultation, and technical assistance to child welfare workers and juvenile probation and parole officers. Another threat is a constantly changing regulation and policy regarding the use of social media. It could be delivered at any time from the state, and this could be a threat to this campaign. In regards to our social media marketing plan, we have several strategic target markets: child welfare professionals, universities that house a social work program geared to providing training to child welfare professionals, national child welfare resource centers for safety, permanency, well-being, and organizational improvement. We believe that these cohorts have their own significant demographic criteria that will help launch UNHCPE's social media marketing campaign. The child welfare professional is a broad term for individuals employed or volunteering to advocate for the protection of children and the well-being of their families. A child welfare professional defined in this social media marketing plan could be a state child protection social worker, also known as a CPSW, juvenile justice probation and parole officer, also known as a JPPO, court-appointed special advocates or a CASA volunteer, and family court staff, which includes its presiding judge. For the purpose of this campaign, the demographic of child welfare professional will be limited to those in DCYF leadership roles and those in a direct service role with children, youth, and families, and to the above categories: administration, CPSW, JPPO, CASA, family court staff. So in terms of child welfare professionals, I made this little target audience matrix. The first one is administration, DCYF administration. Most of them are females with maturing families. They have access to basic technology issued through the state, older versions of RealPlayer, QuickTime, web browsers. They also have their masters. Most of them have their master's degree in social work, and they would need a message from our social media campaign that was specific to New Hampshire practice. This carries over to the child protection social worker. They're very much like DCYF administration. The juvenile probation and parole officers, their demographics are a little more based towards males with maturing family. They have the same access to the basic technology issued through the state. A lot of them have bachelor's degrees, and in terms of messaging from the social media applications, the tweets, the posts, they would need very detailed messaging. This is the matrix continued for court-appointed special advocates or CASA volunteers. Most of them are females with maturing families. They have access to advanced technology, significantly more advanced than the technology issued by the state. A lot of them have their bachelor's degrees, and the messaging would have to be specific to advocacy for children and families. The state of New Hampshire, family courts, is a lot like the administration for child protection for DCYF and child protection staff. They are females with maturing families, access to state-issued technology, very basic technology. A lot of them have their bachelor's degrees, and their messaging would have to be specific to New Hampshire practice, specifically legislation policy for children and families. Another target audience are universities that house a child welfare training program. These include University of Southern Maine, Muskie School for Public Service, University of Iowa School of Social Work, the Silberman School of Social Work at Hunter College in New York, and the University of Oklahoma Schusterman Center. We also have a close relationship with the University of Vermont Social Work Program that we mentioned before, and this would be an example of the universities that house child welfare training programs. The final audience is National Child Welfare Resource Centers, and they were established by the federal government to provide technical assistance and training to state child welfare agencies. There are 11 federally funded child welfare resource centers with specific goals and ways they assist child welfare agencies. Most of these national child welfare resource centers have a social media presence to share resources, announce nationwide webinars, trainings, and conferences. The national resource centers are spread through the United States, and some are attached to the State University Child Welfare Training Partnership. They are the National Child Welfare Resource Center for Organizational Improvement out of the University of Southern Maine Muskie School for Public Service in Portland, Maine. Both the National Resource Center for Child Protective Services and the National Resource Center on Legal and Judicial Issues out of the American Bar Association Center on Children and the Law in Albuquerque, New Mexico. The National Resource Center for In-Home Services out of the University of Iowa School of Social Work in Iowa City, Iowa. The National Resource Center for Permanency and Family Connections out of the Silberman School of Social Work at Hunter College in New York. National Resource Center for Child Welfare Data and Technology, the National Resource Center for Tribes, and the National Resource Center on Adoption is out of the Children's Bureau in Washington, D.C. So our goal for the social media marketing plan is to create awareness and create strategic alliances among 5 social media platforms: Facebook, Twitter, LinkedIn, Pinterest, and YouTube. Facebook, we're hoping to create an awareness of UNH CPE to local and similar national organizations, and we will measure this through the amount of Facebook page members or likes on the UNH CPE Facebook page, as well as shares and likes of posts. With Twitter, we're going to be able to generate announcements for events, retweet tweets generated by local and national partners that match our values, and advertise our enhanced presence. They'll be measured through the amount of followers, retweets, and favorites from our followers on the tweets that we either tweet or retweet. For our LinkedIn profile, we will use it to be able to digitally network with existing partners and create strategic alliances or relationships with new ones. It'll be measured through the amount of groups joined, through invitations or requests to connect, as well as poll questions answered. For Pinterest, we'll be able to create unique picture boards pinned with relevant infographics related to our training series, summits, conferences, the content that we provide in our trainings, as well as our values, and will be measured through the amount of repins, board follows, and followers. With the use of YouTube, we'll be able to post and repost relevant training videos related to our training series, our summits and conferences. The outcomes will be measured through the amount of YouTube subscribers to our channel, as well as the amount of likes per video. For all 5 platforms, we're hoping that it will create a greater awareness of our program within New Hampshire and nationwide, and also create a social media presence for our program among the 5 social media platforms: Facebook, Twitter, Pinterest, LinkedIn, and YouTube. This is our logo, and it's the UNH CPE key, and it was created using the letters C, P, and E. The key is used as a metaphor to unlocking and gaining access. UNH CPE positions itself between 2 large bureaucracies, the University System of New Hampshire, or the University of New Hampshire, and the DHHS, Division for Children, Youth, and Families. These 2 bureaucracies can seem to be locked or inaccessible. It was a goal of the logo to show the users of UNH CPE services that they would be able to gain entry and footing in both overwhelming institutions. Okay, the colors for the university is strongly enforced. There's a graphic standard that all programs have to abide by at the University of New Hampshire. The blue color is known as University Blue. It's Pantone color PMS 288. It is a dark blue that is highly saturated and warm. The font, optioned in white, black, or University Blue, must be Palatino Linotype. The body of the web page or any copy content accompanying the UNH logo can be in Arial, Calibri, or Palatino Linotype. The UNH CPE website is our only existing media platform. It's a simple extension of the UNH brand with a few program-specific allowances. UNH CPE has been allowed to create a gallery for New Hampshire's children awaiting adoption, also known as the Heart Gallery. It's pictures of children and youth awaiting adoption in New Hampshire. The photos transition with their name and age attached to the photo. Information on how to adopt the children is below the pictures, positioned in the Adobe Flash slide carousel. UNH CPE was also allowed to have orange buttons to highlight clickable interactive areas on the website to request a speaker. We also have a suggestion box and how to register for summits and conferences. The way I'm going to structure the report out for the 5 social media platforms that we use are hitting on 3 major points. The strategic alliances that we considered with the specific social media platform. What was the plan specifically? I'm going to reiterate that. And what were the results? And this is for Facebook. Because our contract lacks any real competition, I focused on strategic alliances. We wanted to align our program with in terms of our values and the programming that we provide. For Facebook, there's 2 major strategic alliances that we wanted to make. The Child Welfare League of America. It's a powerful coalition of hundreds of private and public agencies serving vulnerable children and families since 1920. Their expertise, leadership, and innovation on policies, programs, and practices help improve the lives of millions of children in all 50 states. Their impact is felt worldwide. That was one of them, and there's their Facebook page link. We also wanted to align ourselves to the Juvenile Justice Information Exchange. And the Juvenile Justice Information Exchange is a publication that shares scholarly articles regarding juvenile justice and juvenile justice reform. They were an ideal fit because they, like UNHCPE, are housed out of a university partner. They are from Kennesaw State University near Atlanta, Georgia. Their articles information will reach to our juvenile justice audience because of the objective and empirically supported information that they provide. They also have a YouTube channel and Twitter account, and their website is jjie.org. With the Facebook page, our primary outcome was to be able to create awareness to local and national-like organizations. The way we would measure this is through the amount of Facebook page likes, which kind of makes them members to your feed, shares and likes of our posts, and the tracking of visits to our webpage redirected from the Facebook UNHCPE page. Our goal within 30 hours were 10 members or 10 page likes, 3 shares of content, 5 likes of content, and 5 website visits to our unh.edu/CPE website. Some of the daily tasks included checking for relevant posts to share on our Facebook page, post content if available from others. Now we're going to talk about our Twitter account, UNHCPE, that's our handle. Our strategic alliances were Dana Christensen at SBC Best Practice and the National Child Traumatic Stress Network, which was at NCTSN. Dana Christensen is the creator of solution-based casework, and the state of New Hampshire has implemented a practice model that is constructed around this philosophy called solution-based casework. It takes elements of relapse prevention and solution-focused intervention philosophies and combines them into an evidence-informed practice for child protection social workers and juvenile justice probation and parole officers. It would be an interest of all our audiences to position ourselves with Dana Christensen and his Twitter account, because the philosophy and implementation of the model are still in their early phases, and retweeting Dana Christensen's tweets would draw them to our Twitter feed, as well as providing them with content about solution-based casework. Dana Christensen also has a Facebook page for solution-based casework, and with the National Child Traumatic Stress Network, the state of New Hampshire has also requested that we put trauma-informed resources in all of our core and related training series curriculum. And recently, I was sent to California to participate in the revision of the national curriculum of the Child Welfare Trauma Toolkit. So both of these two practice connections are essential to aligning UNHCPE with NCTSN in a social media marketing campaign, as well as Dana Christensen, to provide tweets to links and resources through both of the Twitter handles. The resources are extremely relevant to our main audience of child protection social workers and juvenile probation and parole officers. NCTSN also has a Facebook page. The primary outcome for our Twitter account was to be able to generate announcements for events, retweet tweets generated by local and national partners that match our values, and advertise our enhanced online presence on the other social media platforms. We would measure its success through the amount of followers, retweets, and favorites, and the amount of website hits generated through our Twitter profile. So our goal within 30 hours was 5 followers, 2 retweets, 2 favorites, and 5 website visits from our Twitter handle. So the results of our Twitter account within the 30 hours. We have 10 followers, which are 2 CPE staff, 2 organizations that are child welfare related, 2 child protection social workers, 1 DCYF administrator, 2 UNH employees, and 1 unknown follower with tweets that we wouldn't have anything to be concerned about. And we created a LinkedIn profile. We had 2 strategic alliances for our LinkedIn profiles. First one is the National Council of Juvenile and Family Court Judges. That's one of our main target audiences, as well as the Child Welfare, Child Protection, and SACWIS Professionals LinkedIn profile. That's actually a group. SACWIS stands for the State Automated Child Welfare Information System. Our primary outcome for our LinkedIn profile was to be able to digitally network with existing partners and create new strategic relationships. The way we would measure the success of our LinkedIn profile would be the amount of groups successfully joined, number of professionals linked to CPE's profile through invitation or request, the amount of poll questions answered by our program, and the amount of website hits generated through our LinkedIn profile. Our goal within 30 hours was to join 3 groups, be allowed to join 3 groups, connect with 10 professionals, answer 2 poll questions, and receive 5 hits from our LinkedIn profile to our unh.edu/CPE website. So within the 30 hours, we were connected to 7 professionals. 1 was a UNH CPE staff, 1 was an adjunct lecturer on educational rights of children in care, 4 were professionals from War Child UK from the United Kingdom, and 1 was a council member in New Zealand. We were accepted into 6 groups. They were the Child Welfare Training Professionals, which is a great connection, Child Welfare Advocates, another great connection, Child Welfare, Child Protection, and SACWIS Professionals, which was one of our goals, Education of Children in Care, Juvenile Justice Information Exchange, and the Juvenile Justice Reform and Adolescent Substance Abuse. Unfortunately, we weren't able to answer any poll questions. We had a huge summit and Juvenile Justice Academy that we had to attend, but we did receive 11 hits to our website from our LinkedIn profile. These are the results for our Pinterest boards. We considered 2 strategic Pinterest alliances, one of them socialworkerhelper.com. They're a free professional networking community for social work and other helping professions with a mobile app and free resource repository. They have several boards for their favorite apps, quotes, and infographics for all helping professions. And then we also considered Florida DCF. It's one of the few state child welfare agencies that have a Pinterest board, and they utilize their boards for parenting tips, family activity ideas, adoptions, and ideas for child care providers. Our plan was to create unique picture boards and pin relevant infographics related to our training series, our summits, and conferences. The way we would measure our success was by the amount of repins and board followers, as well as the amount of redirected traffic from our Pinterest account to our UNH CPE website. Our goal within 30 hours was 5 repins, 3 board followers, and 5 hits to the UNH CPE website, redirected from our Pinterest account. Unfortunately, Pinterest wasn't the platform for us. We tried to get results by using the platform's main use, crafts, recipes, parenting tips. We didn't get results. Also infographics. We didn't get results with that. We had 22 pins among 5 boards. The 5 boards were the training room, child welfare specific to child protection, child welfare specific to juvenile justice, curriculum and infographics, and fun for the family. We got 0 repins, 0 board followers, and 0 hits to our website. And finally, our YouTube account. We considered 2 strategic alliances, the Court-Appointed Special Advocates YouTube channel, the address is right here on the slide, as well as the Administration for Children and Families. We have a strong partnership with CASA of New Hampshire, and the Administration for Children and Families is the parent organization for all state child welfare agencies. Our primary outcome for our YouTube channel was to be able to post and repost relevant training videos related to our training series, summits, and conferences. The way we would measure its success was by the amount of YouTube subscribers to our channel, the amount of likes per video that we posted on our channel, and redirected traffic from the channel to our website. Our goal within 30 hours was 3 subscribers to the UNH CPE channel, 2 likes for any of the videos that we had posted or reposted to our channel, and 5 redirected hits to our website. And these are the results. We got 0 subscribers, 0 likes, and 0 hits to our website, redirected from our YouTube channel. In the beginning, it was shut down because of the name. I chose UNH as the first name and CPE as the last name. Google caught on to my trick, and it had to be a person's name, so I put Petty in the first name and Hall in the second. And it took that, but that could have caused some people to not view our channel. We couldn't generate enough content in the time frame, 30 hours, which is divided by 5 for the 5 platforms. It is a good tool for later, but it's not something to actively promote our program or something that we'd significantly invest time in to raise an awareness about our program. For lessons learned, I wanted to talk about 4 points: branding, amount of research time, generating content, and aligning that content to the platform. In terms of branding, it was a big time consumer. Putting up the logo, resizing the images to make banners, that definitely took more time than I thought it would. Also, research time. When I say research time, I'm talking about the followers for our Twitter account, the retweets, the page likes, the content even to paste on the Facebook or share on the Facebook and retweet. There's a significant amount of research time that has to be done, especially when you're in an organization that's somewhat politically charged with its affiliation with a state agency. It could be any state agency. Content generation was difficult too with the amount of time that I had, as well as trying to align the content to its platform. Pinterest, I tried to make it specific to really its kind of purpose right now, which is crafts, cooking ideas, infographics, and I was able to be more diverse with my application of content to Facebook and Twitter. I had to the content had to be very professional for LinkedIn because it is a professional networking site. So based on my experiences with the 5 platforms, we're ready to move forward the next steps with the 5 social media platforms. And you can see this diagram, active use Facebook. We're definitely going to invest more time in that. It's definitely a great tool. Twitter is another great one. You can gain a lot of followers and retweet a lot of great content from the people that you're following. And LinkedIn, there's some great resources and helps you feel like you're not alone, especially in a very specific job, which is child welfare training. The ones that we're going to save for as a tool later on is the YouTube channel. As soon as we generate more content, we'll definitely upload it to YouTube and Pinterest too. It will be a great tool for pictures and infographics as they become available. What's great about YouTube and Pinterest is that you have the ability to share, so that because we're going to actively invest our time in Facebook and Twitter, our use of YouTube and Pinterest can be shared on those 2 major social media platforms. And that's it. Thanks so much for watching my presentation and the great class. I really enjoyed everyone's posts and the resources that they shared. If you have any questions or comments, I'll answer them on our Facebook page. And thanks for everyone for a great class, and I look forward to meeting you or working with you in the other courses offered by the PSU MBA program.